Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well, we've had a busy week here at the clinic. We finished our training on our new neuropathy protocol called Neurogenx, which incorporates a diagnostic element called TM flow, a local nerve block, and then the treatment itself. We're getting some great response so far, and if you're suffering with neuropathy, you're definitely going to want to give us a call. Stay tuned. This is information you definitely don't want to miss. Okay, Dr. Mike, we've been talking about treatment options for neuropathy for a few years now. And just to recap, neuropathy is a major problem. I think one of the statistics for pain associated with treatment for neuropathy is around $842 billion. And we've always taken the approach too. Traditional medical approach is really focused just on symptom management with a lot of addictive pain medications. We now have a treatment solution for neuropathy that actually has been shown to increase the neurovascular bundle in the lower extremities. This has been really exciting.
It really is, and that large number is because because we don't have treatments, really good treatments to take care of neuropathy. There's just so many medications that are tried. There's lost time at work to go to the doctor's office. There's lost time to get to your office because you have to be out of work because something is hurting. There's numerous types of procedures being tried that we don't know if it's going to help or not help. So neuropathy is just this big black hole of difficulty to really know what's causing it, because there are many reasons that can cause neuropathy or nerve damage in your limbs. Yeah. And then there's not a lot of good treatments to know once you even figure out, and we can't figure out always where it came from, to then say, okay, we have a good understanding what's going on with you, but we don't know what to do about it. So let me throw the most common problems or treatments to that patient. It's a lot of frustration. Now we have something based on some science that's been going on for the last decade or so. There's more and more understanding that if you use electrical stimulation as a treatment, you can enhance recovery by increasing the blood supply to that nerve, increasing the way in which the nerves fire and function so the pain can be reduced, those odd sensations can be minimized, and then hopefully, as a person's better, will of course improve their quality of life and improve their function.
Yeah, it was interesting that this week you had said too, there was an article in New England Journal of Medicine that highlighted that. And what's exciting too is, some of the pre and post testing with punch biopsy shows increase in nerve density fibers to the lower extremity. I mean, that's a game changer. And as we've been talking to our patients about it, this week was an exciting week. We had, a group of patients, including my mom, Joyce, go through the treatment. But I thought this week it would be a good idea to just talk to the audience about what the treatment entails. So we basically have three components. We've got this diagnostic test called TM flow. We've got a local temporary nerve block, which assists to have the patient go through the treatment at a more comfortable level. And then the treatment itself, called the Neurogenx, is a form of high intensity electric stimulation that helps to repair and regenerate those nerve fibers. So the TM flow, what's the best way to describe it? So the patient has 4 blood pressures on one on each arm, one on each leg, and you go through a series of tests to establish blood flow through the lower extremity, correct?
That's a nice simplistic way to think about it. And the concept is if we're not getting blood supplied to a problem in our body or in a location, we're not really getting nutrition there. So this is a way to measure the pressure in the limbs. We all get a blood pressure cuff and get our blood pressure checked, but this is a way to check it in the ankles and compare it to the arms. And if the blood flow is diminished, you're likely to have problems. And there's a neurological and a neurovascular connection. So we recognize through that diagnostic test that this is a way to identify this person's at risk and may in fact have problems both in the blood vessels and the nerves going into the limbs.
Right. And then the next phase is you just have a temporary nerve block, or just to kind of numb the area itself. That just takes a few minutes. There's two nerves in particular that Alex focuses on. We're talking about the distal aspect, the sciatic nerve, common peroneal nerve, and the saphenous nerve, correct?
Yeah, so it really is simplistically, if you numb up the area a little bit and we apply this, again, device and stimulation, you're going to be able to tolerate the treatment better. We're going to be able to increase the intensities, and we know that the longer you can get the treatments, because it's done over a number of weeks, and you can increase that, again, stimulus by the electrical stimulation. The Novocaine really just helps diminish that discomfort that may come along with it, but it also relaxes the tissue so we don't go into these constricted phases, allowing the blood vessels to open. And then that's what really makes the difference, is that the nerve blocking combination increases the blood supply, again, helping to repair the nerve.
Yeah, that's great. And I know personally, when talking to my mom about trying this program, and she suffers from neuropathy due to her chemotherapy treatment with her cancer. She was a little leery. You talk about a treatment that you need a nerve block for. Oh my gosh, it must be really painful. But boy, she just went through the treatment completely fine. She said it felt great. There was no pain associated. The treatment itself, the Neurogenx, that's that high intensity electric stimulation. So if you're familiar with physical medicine, chiropractic, physical therapy, we all know back in the day, the TENS machines or the electric stim machines that you would see for pain control, this is much different, right?
Yeah, and the concept is that TENS has been identified years ago to know there's definitely some benefit to this electrical stimulation concept. We put electrical charges over the body in the certain areas that are damaged or having troubles. You can get some positive results of pain management and improvements. Now, as the technology has improved, as the science has gotten better, now they've modified the frequencies, they've modified the way in which it's delivered, and now, although it's an external device, not going to that point of an implantable surgical device, you can get some of that charge and that electrical stimulation on the surface to where the problem is, such as your legs with the neuropathy. And that's really what we're really looking at, this new technology to bring a treatment that is not difficult to do, can be done in the office. It just takes a number of series of sessions.
Yeah, and you're in the office for about 25 minutes or so. Typical protocol, the patients are coming twice a week for 12 weeks, then a reassessment is done. But the game changer is that it actually is getting to the root cause of your problem. This is not a treatment option that is masking your symptoms only. We're seeing, evidence where it's actually helping to increase neurovascular density to the lower extremity, so it's adding as a healing agent as well.
And let's be clear also, we're getting to the root cause because the pathology is in the nerve, but you might be having that damaged nerve because of these other conditions of which you might have. One of the most common is diabetes. So if you have a diabetic neuropathy, well, the diabetes is leading the charge to cause the nerve to damage. So we have to still work on your diabetes. We have to make sure that that person takes it full-hearted, that they need to get their body under control and improve their weight and improve their actual blood sugar control, because that's going to prevent it from coming back. So we're going to get the nerve improved because you're getting to the root of the nerve damage, but we want to work on you in order to make sure you actually take care of yourself to make this treatment last longer.
And that's a great segue, and this is what really makes a difference here at our clinic at Maragal Medical. We're a one-stop shop, so if you are a diabetic, guess what? We have a whole food-based medical weight loss program that has been hugely successful. So that's one of the things that we add. And also, we're a full-service physical medicine clinic. So you, as our medical director, as a physiatrist, you have that expertise to make sure that it's a very accurate diagnosis. And when we combine that with our wonderful chiropractors and our physical therapist, my wife Colleen, what a winning combination. One-stop shop, you can get all of your treatment here under one roof. Folks, this is great news. We're so excited to be launching this brand new neuropathy program called Neurogenx. If you'd like more information about the program itself, you can check us out on the web at maragalmedical.com. Please consider subscribing to our YouTube channel as well. We update that on a weekly basis. And best yet, this treatment is covered by most insurances. Well, that's it for today. I hope you're excited, and I hope you can pass this information along to someone you know that may be suffering with neuropathy, because we can definitely help you out.
Take care.
Have a great day.